Good morning, everyone. Welcome to the Hindu Physicians International's Distinguished Webinar Series. My name is Dr. Adityanji, and I am the president of the Hindu Physicians International. What you see is the logo of the Hindu Physicians International. Our mantra at HPI is Sharira Madhyam Khalu Dharma Sadhanam. That means body is the first temple to worship. That is true for all our patients as well as for us physicians, because most of the time we physicians don't take care of our own health. So it is very, very important that we remember this mantra, Sharira Madhyam Khalu Dharma Sadhanam. Today is May 17th, Sunday. It is 10 a.m. Eastern Standard Time, 7:30 p.m. India time. And our distinguished speakers today is a dear friend, Dr. Rakesh Sharma, and he is going to be speaking on a very interesting subject, which is how to live longer. All of us fancy with the idea of wanting to live longer. So that is what he is going to be speaking about. A little bit about what HPI is. We are a faith-based charity by physicians of dharmic origin to serve the entire humanity. We have a self-governing board of directors with 5 members. We are a non-profit organization registered in the state of New York. And we basically follow the Sanatan Dharma concepts like Naraseva, Narayan Seva, Vasudhaiva Kutumbakam. Yes, we are a faith-based charity, but we strive to serve the entire humanity. That is our mandate. But we do include the dharmic concepts in our day-to-day functioning. We have a board of directors, and the next slide will probably tell you about that. We decided to start this because I noticed that there were a lot of faith-based medical charities. Hindu physicians were not operating under a dharmic framework. We were working under secular framework. There are a lot of organizations of Indian physicians or Hindu physicians, but they do work under secular framework. So that's why we started this. We have a board of directors with 5 members. The names are written here. I'm not going to go into that. We have an international advisory board of eminent physicians from all over the world. They just give us the guidance. They do not operate day-to-day functioning. And then we have an executive committee of much younger physicians that take care of the day-to-day work. And in fact, we are always looking for young physicians who are willing to donate their effort and time and wish to serve on the executive committee. We will welcome you to contact me. Our latest addition to the executive committee was Dr. Dipali Desai, who is Director of Outreach to Dharma Organizations. So we invite all of you to join us. And if you have time, please, serve on the executive committee. On objectives of HPI are short-term as well as long-term. The short-term are that we promote local community service or seva activities. So we encourage all the physicians that in your spare time, in your own community, you do some community seva project. There are long-term objectives that include, humanitarian assistance, disaster relief, cleaning the environment, assisting in providing clean water, etc., etc. But those are the long-term aims. And those of you who came for this probably also saw our flyer. Just one issue that our membership is free. If you go on our website, there's a membership form. You can fill it up. It is not just for physicians. It's also for other allied professionals also, whether you're a social worker, you are a psychologist, whether you are a radiographer, whether you are a medical student, whether you are a medical scientist. Membership is free for everyone. It's just for namesake that we want you to fill up the membership form. There's a community seva project form. So if you have a project going on, you can fill this form and we can certify this as an HPI community seva project. You retain full control of the project. It will be under you. You will be doing this. And of course, we have this distinguished Hindu physician lecture series. And today it will be Dr. Rakesh Sharma. And many of you probably saw this flyer in your WhatsApp groups and email or something like that. Dr. Rakesh Sharma is a distinguished physician speaker today, and you will be seeing him. But this is a picture of Dr. Rakesh Sharma. He was born in New Delhi, India. He did his MBBS from Gandhi Medical College in Bhopal in MP. He completed his residency in internal medicine from New York in 1985. He did a critical care medicine fellowship from New York. He was chairman of medicine from 2014 to 2022 at St. Catherine of Siena Hospital in New York. He is also director of critical care medicine since 2018 at the same hospital. He obtained his MBA from Adelphi University in New York in 2017. We are very pleased that he is one of the founding members of the HPI as well as its secretary. We promote local seva projects and we partner with other organizations. So this is going to be a walkathon along with BAPS for fundraising purposes. This is being done on June 6th in Cleveland, Ohio. So we support all charitable organizations, whether it is Rotary Club, BAPS, whatever entity that is doing some community seva, we help, we partner with them and we help with them. Next one, there are a few, we'll just run through some of the pictures of the seva projects. This was on Pahalgam anniversary in one of the local temples in Cleveland. Next slide, please. This was actually HPI project done in New York by Dr. Sharma along with Rotary Club. Next one, please. From the same one, Seva project, we worked with the Cleveland Food Bank and sponsored around 12,000 meals last year. Next slide, please. These are some of the people who participated in that. Can we run quickly through the slides? We also work with, Gathering Place, which is a cancer survivors charity supporting, and we raise funds for them. They basically help with rehabilitation of cancer survivors, mainly women and children, provide important things like, wigs for women who have lost their hair for, because of cancer chemotherapy. So those are the kind of projects we sort of support. If you want to support us financially, you can go to our website. Please donate and support HPI. You can pay by PayPal or you can make a check and send it to our PO box. That will go for a good cause. All of us are volunteers. No, there are hardly any administrative overheads. And with that, I'll be finishing my presentation. This is the Swasti Vachan. So before I hand over the platform to Dr. Rakesh Sharma, who is going to be talking about Swasti, how to live longer. So I will just chant this shloka, Swasti Vachan. Om Swasti na Indro Vradhrashavaha Swasti na Pusha Vishwavedaha Swasti Nastakshyo Arishtanemihi Swasti no Brahspatir Dhadatu. So it's my honor and pleasure to give the platform to Dr. Rakesh Sharma, who will be talking about how to live longer, that is, in practice, how to embody Swasti Vachana. Dr. Sharma, the platform is yours.
Thank you. Good morning. As Dr. Aditya Ji's introduced me, I'm Rakesh Sharma, and I have the pleasure of talking about this topic today, which is living healthier and living longer. Some people did call me saying, my lecture is only how to live longer. Why not you say how to live longer and healthier? So this is the topic. I am sure all of us who have been living in US as well as our audience in India knows very well if we are in medical profession, what are the different factors that will make us live longer. Uh, it's not just the number of years, it's also number of good years. If you all remember a movie, Anand, Rajesh Khanna said, you know, life should not be longer, life should be good. So, yes, concept is great, but let's take one thing at a time, how to live longer. Then second one will be how to live healthier and longer. And third one will be how to live longer, healthier, and happy. So this is a big task. We all know by living in this social media network that a lot of information is there, and we can take advantage of all the information that we have. I will start from the beginning because I always felt that whenever anything is discussed, we should go to the root of it and not just what present day or future problem is going to be. As we know, Homo sapiens came to this planet 200, 300,000 years ago. Then there was ice age and ice started to melt and we started to have agriculture roughly 10,000 BCE. What did people eat or Homo sapiens eat? Animal products and some plants, leaves, fruits, and berries and roots. So we grew up like that. So our DNA has been adjusted to those things. And I will be focusing more on USA and India, or the people of European descent as well as people of Indian descent, because that's what our audience is. Uh, in India, most of us, until perhaps 500 BCE, ate 50% diet from meat products and other 50% from plants or fruits. Why do I say that? We were quite meat eaters until Jainism and Buddhist religions came about 500 BCE. That's when we started to turn vegetarian in very mass number. Roughly 200 CE, a lot of Indians became vegetarians. Why is that important? Our DNA was set for something, and then 40-50% of Indians stopped eating meat. So we have certain genetic predisposition. There are some genes in Indian people that put us at high risk for type 2 diabetes. These are special genes that are found in pancreatic beta cells. And if somebody is interested, they are called TCF 7L2 KCNJ11. I'm sure these names are very difficult to remember, but just to let you know, this is why we Indian or people of Indian descent have very high risk of type 2 diabetes mellitus. The reason I'm mentioning that, we will go in detail later on. Why is it important? So that was a little background. And if you go back in just 125 years ago, in 1900, in US, you know what the life expectancy was? It was 44, 45 years. I mean, if USA had life expectancy just 125 years ago, 44, 45, that's pretty bad. But believe it or not, when I did some research, it didn't mean that most of the people died at 44, 45. It was pulled down because infant mortality rate was sky high. So if you adjust for infant mortality rate, most of the people in USA in 1900 survived till the age of 63. That was the average age of an adult who, if you didn't die by the age of 5 as a child, you probably lived till the age of 63. So in 1900, if people in USA on an average lived till the age of 63, and now we know in 2025 life expectancy in USA is 75, 76 for males, 78, 79 for females. So what did we achieve in the last 125 years? We went from 63 to 76, 13 years. And in these 125 years, if we increased our life expectancy by 13 years, that is because of clean water, vaccinations, antibiotics, and hopefully some good food. If you look at this with so much information and so many good points, all we added in the last 125 years was only 13 or 14 more years. So, what that means is somewhere we didn't do great job after being so advanced in the last 125 years. But the good news is people who are 65 these days or right now in USA, 50% of them will survive till the age of 83. So that's a good news. If you are 65, half of you will live till the age of 83. If you are 65 and don't have any major health issue, you will live even longer because then you have 70% chance of living till the age of 83, 84. And if you have some ailments at the age of 65, you have 22% chance of living till the age of 83. That's a good news. How do we make it longer? So there are plenty of things that we already know. Let's look at these 8 pillars of life. If you don't smoke, you don't drink excess alcohol, you have good nutrition, you have good social connections, physical activity, good sleep, you don't have stress, and of course, the last one, no opioid use. So before I go into detail, if you all have looked at certain shows that Who Wants to Be a Millionaire and Kaun Banega Crorepati, you see there are certain levels of awards where they say, okay, if you give wrong answer, you will not go down to zero. You will get at least some money. So I did some research and found there are two major levels of our life expectancy where if we cross that we have better chances of living longer. What are those two age levels? One is, I think, age of 50. The second one is 65. Why do I say up to age of 50 is important? If you look at 5 main causes of death in United States, the number one is cardiovascular disease, number two is cancer, number three is accidents or things that were unintentional, and number four is stroke, and number five is respiratory diseases or chronic respiratory. So if you make it up to the age of 50, you have great chance of going up to 65. Why can't people make even up to the age of 50 in US? I think the major reasons are drug abuse, too much alcohol, giving cirrhosis of liver, and number three, accidents. Accidents actually cause $160,000 deaths in the United States. So what do we learn from this? Don't abuse drugs, drive carefully, don't drink too much alcohol in your younger years, or don't be alcoholic. You will definitely make it to 50. So if you make it to 50, then the next level is 65. And after 65, as I said, you have 50% chance of making it to 83. So let's do that and find out what things are very important. Now, smoking or not to smoke is also a great factor. The reason being, we have been told as medical students or doctors that smoking causes COPD and CA lung or cancer of the lung. But what we missed 40, 50 years ago, when we all were young doctors, that we concentrated only on respiratory illness as far as smoking was concerned. But now whenever I see a young patient with acute MI in my CCU, I ask only two questions. Do you smoke or do you have diabetes? Because people who are 45, 50 years old, when they get heart attack, I can bet you that two out of three reasons are smoking, diabetes, and third could be, hereditary. So if you don't smoke, you not only prevent COPD or cancer of the lung, but a lot of cardiac diseases, stomach ulcer, CA stomach, CA urinary bladder, kidney, and all that. So smoking to be stopped if you want to live longer. One thing which has been in limelight for the last 20, 30 years, and lately much more, is exercise. If someone asked me 25 years ago, what is the impact of exercise, I would have spoken like a layperson. And I'll be very honest with you that most of the information that I gathered in the last 3 weeks when I chose this topic, I did not know half of the stuff myself. Even being a physician, and I think I'm a good physician, I did not know so many things. So, what did exercise do? If you look at certain research analyses, they might put physical activity or exercise perhaps very, very high if you want to live longer. So, exercise has shown if you have 150 to 300 minutes per week of walking, or there are different things that you can do. It does decrease your premature death or early mortality by 31% or so. So when we say exercise, every 5, 10 years, unfortunately, we get information, we get confused. 5, 6 years ago, we were told that if you walk 4,000 steps a day, your mortality will go down by 30%. A recent study has shown that you must walk 9,000 to 10,000 steps a day. It just reminds me of old Indian song. I think our Indian songwriters knew this 50 years ago. That's why they wrote a song, Jeevan chalne ka naam, chalte raho subho sham. So you really have to walk every morning and every evening to walk 9 to 10,000 steps every day. But that I'll leave it up to you. The point is, do good physical activity. If you can't walk 9 to 10,000 steps, walk 4,000 steps a day and cut down your mortality by half of what 10,000 will do. To me, that is a very good thing to do, but don't wait till the age of 65. Start early on in your 30s and 40s. What if we all missed? If you were like me, you didn't start exercising at the age of 30, 40, start it now. It's never too late. Some resistance exercises, treadmill, whatever you can do. Now, second thing is diet. If I look at uh, some slides, some slide will say diet is the most important thing. And why do they say that? Number one reason being, as I said previously, of dying is cardiovascular disease. And we know our heart or coronary arteries are directly related to what we eat. So we are what we eat. Unfortunately, we people of Indian descent do have some problem. We have slightly narrower coronary arteries. We have some gene abnormality where we are at high risk of type 2 diabetes mellitus, as I said earlier. We also have some deficiency of vitamin B12, which causes some metabolic uh, deficiency. So we are at very high risk of getting metabolic syndrome, type 2 diabetes, little smaller coronary arteries. And that's why 50% of the coronary arterial disease of the world is in India. So 1.4 billion people are responsible for 50% of CAD. That's a bad news for all of us. But good news is, since we know what to do about it, we should be doing and not blame our genes or ancestors. Very first thing is diet. When I say diet, we should be cutting down on carbohydrates. There's a nice pyramidal tree that we have made, which unfortunately I don't have that slide. So, vegetables and fruits at the bottom, then carbohydrates, then fruits and sweets at the top. So, means eat as little sweets as possible, which is refined sugar. Uh, so diet is so important. So what is good in diet? We all know that we have to eat carbohydrates, but eat carbohydrates that are very high in fibers. Uh, and what we have learned from analysis is that every time we consume 1,000 calories, we should have at least 14 grams of fiber. So latest recommendation is for women, they should eat 25 grams of fiber every day, and men should eat 35 grams of fiber every day. If we can do that, uh, our diet will improve. We will have less chance of metabolic syndrome and less chance of diabetes mellitus. As we know, fibers are in certain fruits, legumes, whole grains, and vegetables. So we need to consume a lot of those things. And other thing, if someone is very much into diet issue, we know Mediterranean diet is quite popular and rightfully so because it does support things that are more in line with fruits, vegetables, and fish. Fish being omega-3 and good fats. At the same time, studies have shown that if you eat fish twice a week, your chances of getting cancers and coronary arterial disease goes down. I just want to throw one point. Our civilization in India started around Saraswati River, what's called Indus River. You know, people used to eat a lot of fish those days. This I'm talking about 2000 to 4000 BCE. So we knew at that time what to eat, but somehow after a common era started, we forgot and became more carbohydrate eaters. And weight is so important. And I'll share something with you that BMI of less than 25 is considered healthy weight. 25 to 29.9 is overweight, more than 30 is obese. But these are very restrictive BMI. The reason I am saying that is there was a multi level study done. They looked at everything. And the funniest thing is, this BMI of less than 25 is good for younger people, but once you are 65 and over, studies have shown that people who are 65 and over, if their BMI is less than 25, they have increased mortality compared to people of 65 and over who have BMI between 25 and 30. So if you are 65 and over, you are better off having slightly higher BMI, not what the book says. So have your BMI between 25 to 30. I myself just lost some weight and have BMI of 25. I'm going to gain few pounds to live longer. Now, other two things which some of you may have read is sleep. There has been a lot of emphasis on good and longer sleep these days. An average person perhaps doesn't sleep that good or that long. Most of us go to bed late and we wake up early and we work harder. That's how the capitalism has shown us. Work more, make more money, get a bigger house. But the studies have shown if you sleep 7 to 8 hours a day, you will live longer. So 7 hours is minimum. If you add an extra hour a day, so instead of 7 hours, if you sleep for 8 hours, your chances of survival goes up by, I think, 20%. So stop yelling at your teenage children. Let them sleep till 11 o'clock on Sunday, Saturdays and Sundays. And you should also not wake up 5 in the morning on the weekends. Alcohol, yes, we all know alcohol is bad. Little bit, one drink a day may be okay for those who drink. If you don't drink, please don't start drinking. A lot of studies have shown that zero point 0.6 ounces of alcohol is good for women, and maybe 1 ounce is okay for men. Women cannot tolerate that much alcohol. So if you must drink, one drink a day, not more than that. But yes, sleep for 7 hours. That's a must. So alcohol, less is more. I do agree with that. Sleep, the slide I'm showing now, 7 to 9 hours. And as I discussed, minimum 7 hours. If you go to 8 hours out of 24, your chances will go up by 20%. And quality of sleep is very important too. When I say 7 or 8 hours, if you are 70 years old or 65 years old and you wake up 3 times at night to go to the bathroom because of BPH or some other ailments, that is not a good quality sleep. If you have BPH, of course, I'm sure you will go to urologist and get treatment for that. If you have obstructive sleep apnea, please get CPAP or BiPAP, but quality is as important as quantity. Now, one thing which has not been so much advertised is social connections and stress management because nobody makes money by selling this point. No pharmaceutical company will make billions of dollars by telling you to have good social connections. So you may make statins and make billions of dollars or antidepressant, but no one will stress on this point. And in one study, I found that more than diet is social connection, which is important for not just for longevity, but also for happiness. In fact, there was a study done by Harvard, and Harvard Happiness Index has shown that people who are socially connected very well live much longer than anyone else. If you want to live longer and healthier and happier, of course, all the diet, exercise, weight, not smoking, drinking less. On top of all that, the cherry is social connections. So have friends, families. You don't have to belong to 10 WhatsApp groups. Have two good neighbors, two good friends, three good relatives, and that's all you need. Stress, of course, why stress management is important? The reason being stress causes a lot of inflammation. And I think one of the main reasons of coronary arterial disease in middle age is people who have a lot of stress. It causes inflammation and that gives acute MI. So social connections, as we discussed. Now, as a doctor, I must tell you that all this talk is great. But what if you don't go to a doctor for your screening or physical health? Then this talk has no importance. The reason being, even if you watch diet carefully, you must go for certain screening tests. If you are a woman at the age of 40, you must go and get mammograms taken. Although we suggest every year, but the recommendation is every 2 years. So at the age of 40, go get mammogram, pap smear, and for cancer screening, as we all know, colonoscopy was advised to start at the age of 50, but about 5, 6 years back, we have brought the screening age down to 45. So if you are 45 and over, please get your first colonoscopy to have the polyps removed. When you have the polyps in the colon, they are the one that turn into cancer of colon after 8 to 10 years. So have your colonoscopy screening, your occult blood in the stool, your mammogram, your physical, your blood pressure screening, your other cancer screening. As I said, if you we covered colorectal, breast, cervical, lung cancer. If you're a smoker or former smoker, CAT scan of the chest is very important. And for cardiovascular, you have to maintain your blood pressure. All the studies, biggest study that has ever come out in the world is from Harvard called Birmingham study, which is a town outside Harvard. They started in 1936 and they are still doing it. And the entire town, or almost entire town, is enrolled in this study for everything. And they have found out the best blood pressure is 120 over 70 or 120 over 80. Of course, everything that comes out in the study may not be the best. If you are 65, 70 years old, would I suggest you to have your upper blood pressure or systolic blood pressure 120? As a physician, I have seen that you really don't have to. For you, up to 130 is okay. So if you are 65, 70, 75 years old, keep your systolic BP up to 130. But if you are younger, yes, bring it down to 120 or less. Systolic and diastolic always less than 90, preferably less than 84. And go for your diabetes prevention for hemoglobin A1C, fasting glucose, and of course, lipid profile. We all know what good cholesterol is, what bad cholesterol is. You got to keep your LDL low, your HDL up, your triglycerides normal. Your lipid profile should be as good as the book says. Your diabetes and metabolic syndrome are directly related to what you eat and what your weight is. Metabolic syndrome is always, I would say, almost always found in overweight or obese people. There is some exception. As I said, Indians do have a high risk of diabetes mellitus because of our genetic predisposition. We also have some other issue that even we are thin, we carry little more visceral fat. So Indians do have to be extra careful. Why do I keep on stressing that? I think a medical community as well as the government has some responsibility of educating its citizens. If I was a Secretary of Health in United States, I would bring all these points again and again to the public because on an average, general public doesn't know all these things. It is the responsibility of the government also. That's why we have created Department of Health. In India, same thing. I'm kind of shocked that in India we talk about religion and other things so much, but no one tells people that you have a genetic defect. You just cannot keep on eating carbohydrates. You just cannot keep on increasing weight. If you see the diet of people who live in India these days, I get shocked whenever I visit my homeland every couple of years that how much people eat. And weight management, diet, diabetes, all these things are so important. one other thing before I miss that is what we call vanaspati ghee or vegetable oil, vegetable ghee called dalda. We all grew up on dalda. What is dalda? Dalda is trans fat or trans fatty acids. And USA has banned trans fatty acids about 5 or 6 years ago. But if you go to India, dalda is perhaps the most commonly used ghee, and I don't understand why government there has not banned it. If there are some people in this audience who live in India, please stress that point. It should have been banned 5, 6 years ago. And we already have 50% coronary arterial disease of the world in India. Then you feed them trans fatty acids, all you are doing is making CAD worse. Now, as Dr. Adityan ji in his opening remarks said, we want to, uh, serve our body. Sure, we want to serve our body, and so do we want to serve our mind. So, our mental health is so important, which kind of has been realized in the last 20 years in the United States. That's why all the health insurance companies are being forced to give good mental health coverage to citizens here. Uh, we know depression, anxiety, and other psychological issues are very rampant. Unfortunately, what has happened in US is you can see a medical doctor tomorrow, maybe cardiologist in 3 days, but you cannot find a psychiatrist appointment for 3 months. So there must be a lot of mental illness around that we want to see psychiatrists, and there's shortage of psychiatrists. So we need to look into that. Why is mental health kind of so prevalent? Is I think social connection is disconnected. Our family structure has been broken down, and it's not only in Western society, same thing is happening in India too. We used to have joint families, we used to have bigger families. Now we have a family which is husband, wife with one or two children. We need to have a better family structure. Now, I also want to stress something on vaccinations and supplements. We all know we get vaccinations in childhood, but there are certain vaccinations that we need to get when we are grown up as adults. Common ones are herpes zoster that we can start getting after the age of 50. The newer ones are 2 injections, 2 months apart. Everyone after the age of 50 should get it. Other one is a pneumococcal vaccine to prevent pneumococcal pneumonia. There are, of course, COVID-19 vaccine now. I leave it up to people. Do all of us need it? Absolutely not. But you have diabetes, uh, kidney disease, or chronic respiratory illness, please go ahead and get COVID-19. So that's about your. Now, other thing that I want to mention, which is a little surprising, is influenza vaccine or flu vaccine. After the age of 65, everyone must get a flu vaccine every year. Best time is to get in October because flu really doesn't start before that. So I will share a funny study with you right now. If you exercise, your chances of decreasing all-cause mortality is down by 31% if you exercise every day, like we discussed before. But if you don't exercise and after the age of 65, you take flu vaccine every year, your all-cause mortality goes down by 34%. So I'm not asking you not to exercise, but flu vaccine is so important. If at the age of 65 and over you take it every day, your life expectancy is going to increase. So please take flu shot every year and don't listen to CDC directors who are discouraging you from getting vaccinations. Supplements. People, I practiced internal medicine for 32 years and critical care. I've been still practicing for last 35 years. Patients always ask me, doctor, all these vitamins, should I take? And from day one, I told them no need to take any vitamin. And after 5 minutes of conversation, I would give in and tell them to take one multivitamin a day, nothing more than that, and get the cheapest multivitamin. You don't have to spend $1 a pill. So if you want to know what vitamin you should take, if you're healthy, you're eating healthy, you either don't need anything or you take one multivitamin a day. Should you take anything else? That depends on your blood test. If you are B12 deficient, if you're iron deficient, absolutely you take those two. If you're vitamin D deficiency, you take vitamin D because vitamin D is important for your bones, osteoporosis. Yes, vitamin D has nothing to do with heart disease. We thought of it for 20 years, but recent studies have shown vitamin D does not prevent any heart condition. For Indians, should they take B12? A lot of us may have B12 deficiency because of our villi in the stomach. We may not absorb B12 very well. So if you have low vitamin B12 or borderline low, you can definitely take vitamin B12 injection once a month, which is 1000 micrograms IM injection. Now, I'm going to share 3, 4 slides with you. Everything that I said so far, I always said most important, most important, most important. Was I lying? Absolutely not. But all the studies always focus on one thing. Now, if I look at scientific study, they will tell you the number one predictor of longevity is VO2 max. It's volume of oxygen that we use in 1 minute per kg of our body weight. If you use more oxygen during exercise, you are going to live longer. Why is that? Because if you and me can use more oxygen, that means our heart, lungs, and muscles are in great shape. So if you can use more oxygen, means your heart, lungs, and muscles are doing good. So those are the factors that make you live longer. So in a lot of studies, you will find this as number one predictor of longevity. In others, you will find about diet being number one. In others, you will say exercise is number one. In some, you will say after the age of 65, take flu vaccine every year, you will live forever. So all these things are important. Then, of course, someone might say, what about sleep and social connection and weight? Yes, all these things are important. So this is what I told earlier. So if you exercise, your all-cause mortality goes down by 20 to 40%. But if you just take vaccine, flu vaccine, it goes down even more. So don't exercise, just take vaccine. I'm just kidding. Uh, so exercise and vaccine is the importance of flu vaccine that this slide is made of. And this is what the Harvard study had shown about uh, social connections, which we discussed earlier. And this is for longevity and happiness. When people say everything is number one, that's exactly it means all these points could be number one, but we know all of them cannot be valedictorians of the class. So let's make something number one, something number two, something number three. So how do we put all these together? I think if you put all these things together, what in nutshell, don't smoke, either don't drink or limit your alcohol to one drink a day, exercise 150 to 170 minutes a week, keep your BMI less than 25. But if you are 65 and over, keep it between 25 to 29. Have great social connections, 7 to 8 hours of sleep. Don't take any stress, give it to others. And these are all the vaccinations, screening for cancers, and everything else. So that's the take home message. Now, I kept one thing on a side so far. And what is that thing? If I gave you all these points, and you will say, "My God, this is what I'm gonna do starting today," I will. I have one bad news for you, all of you. What I just said is only good for 50% of your longevity. The other 50% is decided about your life by your genes. The day you are born, your 50% longevity has already been decided. Until recently, we thought it was anywhere from 16 to 25% that your genes were responsible, but recent studies have shown 50 to 55%. After another 25 years, some other study may show a different number, and I will not be responsible for this 50 to 55. But if you ask me today, how much is your life dependent on your genes? I will say 50% of your life is dependent on your genes. So you can thank your parents or blame your parents. I will leave it up to you. Your parents, your ancestors. And funniest thing is what your mother and your grandmother ate during her pregnancy is equally important. So you should choose your parents carefully, and you should have told your mother and grandmother to eat healthier food before you were born, because that is what our genes are. So 50% is not in your hands. You have already been given longevity based on that. Other 50% is in your hands. So that's where you have to work on. You cannot change your genes. Thank you very much for paying attention.
Thank you very much indeed, Dr. Sharma, for a wonderful lecture, very practical message, and very simple things to implement. I see that people are very, very involved with your talk. There were a lot of comments on the chat. We will start taking a few questions. We have around 10 minutes. I would invite people to raise their hand using the react button. It is a heart shaped button at the bottom of your screen. So, in the order people raise their hands, we will start sort of taking question answers. My request is that keep your questions simple. Don't get into back and forth argument with the speaker, because they can be varying opinions, but we don't have much time for an extensive debate right now. So we'll start with Dr. Rita Kashi Batija. Kindly unmute yourself, ma'am.
Uh, Thank you so much, Dr. Sharma. Really appreciate. I also happen to be in Long Island, and actually, Dr. Naveen Mehta has introduced me to this HPI because we are very close friends. Just want to bring it to your attention that, as you know, a lot of physicians are not aware of what is in their backyard, which is API National's ebook. I highly recommend every physician to be aware of it and go with that. And of course, RDs and MDs in partnership, since I tell all my patients, be mindful of physician's time. So, this is what I wanted to mention, and thank you again.
Thank you. Thank you for your comments.
Thank you, Dr. Batija. Now it is turn for Dr. Dipali Desai. Dr. Desai, kindly unmute yourself. Dr. Dipali Desai, please go ahead. Unmute yourself. You're muted. Yeah.
Hi, Dr. Sharma.
Hi.
Hi, Dr. Sharma. It was a
Oh,
fantastic talk. Learned a lot from you. And I just want to ask you a question. For stress management, what are the strategies that people use?
Okay, you can write a book on it, but what I can tell you is there are
What
four,
is
five.
what is your strategy for stress management?
Yes. I wish I knew that totally, but I'll give you 4, 5 points. One of them is have good relations with your family. Most of our stress comes from two sources, at home or at work. So if you have great relationship with your spouse, with your children, I think
Yeah,
50% of stress is gone. At work also, uh, be careful what you say. And then on top of that, other things that stress us is maybe financial condition, our ailments, and what we feel about ourselves. One point that I forgot to mention during my talk is how do we feel about ourselves? We got to feel great. If people have nice haircut, they wear nice clothes, they smell good, they actually are feeling good inside, not just outside. People who dress very well, who talk very well, who don't use four-letter words, they feel good. So try to feel good and dress well, look good.
Very good advice, Dr. Sharma. Uh, I saw a hand raised by Professor R.K. Suri. Professor Suri, do you want to ask your question because you withdrew your hand? Dr. Suri.
Thank you, Dr. Adityanji. Thank you, uh, Dr. Sharma, Rakesh Sharma. It was a really excellent presentation by you. Uh, I have learned a lot in today's session. Still, there are certain things which I want to learn from you. Predominantly, uh, when to when to say no in terms of reaching out for help.
I'm sorry, reaching out for
Reaching out for help.
or for help.
Yeah, particularly the diagnostics.
When to say no for reaching out for help means when you're elderly, when someone is 80, 90, 100 years old. Is that the question?
That's precisely uh, in terms of Hindu philosophy. People say no to diagnostic, no to treatment, and when is the time to say no to diagnostics and
Sure.
medication?
See, as we all remember, when we lived in India, I mean, I was 25 when I came here. At that time, when I was 20, 25, I thought person who is 65 years old is old and he's ready to leave this planet, right? That was our thinking 50 years back. Uh, but now 65 years old is a young person. So, so,
There
so
is some
we,
interference,
So
Dr.
age is not a limit anymore. There are people who are 90 years old and feeling great. They should do whatever they want to do. At the same time, there are 70-year-old people who may have cancer spread all over. For them to stay in the hospital for 2 months and then expire is of no use. So once we reach certain age, we should not be that much attached at the age of 90, figuring out how do I make it to 100 may not be the best thing. If you are walking and your brain is working good, sure, go for it. So I would not put any number as a limit. It's all how our body and how our mind is working. So I would say if they are both doing great, continue.
Thank you, Dr. Sharma, very much indeed. My heartful thanks to our distinguished speaker today, Dr. Rakesh Sharma. My thanks also to all our audience members. A couple of housekeeping announcements. We are always looking for speakers. So if any of you have desire to speak on this platform, please get in touch with me on WhatsApp. I'll be happy to schedule a lecture by you on a topic that we can choose about. So we always encourage people to come to our platform and share their viewpoints. That is number one. Second is that we are a non-profit organization registered as 501c3 in state of New York. Kindly support us financially. There's a PayPal link there. As all physicians and healthcare providers, you are fairly well off. Kindly support this noble venture. And lastly, please do some community seva projects in your local areas. Physicians, surgeons, doctors, paraprofessionals, allied health people, all are very important to us. You retain the leadership, you retain the control of your seva project. Please just do some seva projects in your community and get HPI certification for that. We have run out of time, so I will be closing this meeting. But thank you very much indeed to all of you. And we shall resume in a couple of weeks' time again. Namaskar.